This is Edward Siegel. Welcome to the Crisis Ahead podcast. Each week, we look at how companies, organizations, and individuals in the news are responding to, managing, or recovering from a crisis, and what you can learn from their successes or failures. My observations and recommendations are based on my experience managing crisis situations and advising others on how to respond to and bounce back from disasters, scandals, and other emergencies. My guest this week is Rabih Torbay, President and CEO of Project Hope. He'll be here shortly to discuss how the international organization prepares for and responds to crisis situations around the world. But first, I want to say a word about the lessons to be learned from President-elect Joe Biden's plans to respond to the pandemic. COVID-19 is the worst national public health emergency in modern American history. How President-elect Biden manages the crisis could become a role model for business executives on how to respond strategically, effectively, and efficiently to a crisis that strikes their organizations. A reading of the coronavirus plan on Biden's campaign website, his speeches on the campaign trail, and his recent victory speech provide 8 preliminary lessons company executives should take to heart when they prepare or update their crisis management plans. Lesson 1. Be clear and straightforward. Lesson 2. Have specific goals. Lesson 3. Include objectives that must be met in order to achieve the goals. Lesson 4. Establish priorities. Lesson 5. Assign responsibilities. Lesson 6. Identify and obtain resources that are needed to ensure success. Lesson 7. Explain how the plan will be implemented. And Lesson 8. Put experts in charge. I've written a new book that includes important advice on how to prepare for and manage a crisis and recover from more than 100 different types of crisis situations. Crisis Ahead: 101 Ways to Prepare for and Bounce Back from Disasters, Scandals, and Other Emergencies. Crisis Ahead is now available as a paperback book wherever books are sold and as an ebook from Amazon and Barnes & Noble. Crisis Ahead is filled with case studies about how companies and public figures have prepared for and handled crisis situations, and the important lessons you can learn from their successes and failures. The book also includes checklists and exercises to help you get ready for and react to a crisis. You can learn more about the book at publicrelations.com. It's not too early to start preparing for the next crisis. That's because history shows there is always a next crisis, and the sooner you are ready for it, the better. I'm honored to have as my guest this week Rabih Torbay, President and CEO of Project Hope. Project Hope is a global health and humanitarian organization. As noted on their website, Project Hope teams are at work around the world, responding to crises, helping people overcome diseases, and empowering health workers with the training and tools they need to save more lives. Thanks for joining me today, Rabih.
It's an honor to be with you, Edward.
Well, first tell us something about the different kinds of crisis situations that Project Hope has been involved in recently around the world.
Great. Well, as you mentioned, Project Hope is a global health organization. We work in around 25 countries around the globe. And obviously, every country and every situation presents its challenges. And it seems that we're almost always in a crisis mode, whether it's a COVID response that we're leading here in the US, but also have worked in China and working throughout the world on COVID response, or response to hurricanes. And we're seeing a very active hurricane season. Actually, the past couple of seasons have been very active. But in addition to that, we're dealing also with the humanitarian crisis, whether it's Venezuelan refugees in Colombia, or the blast or the explosion in Beirut, Lebanon, or Yemen, and the situation in Yemen as well. So we're dealing with crises pretty much nonstop.
What's the secret for managing so many crises at the same time?
Oh, I wish there was some kind of a secret recipe that we could go to. I think one of the most important thing is leadership and preparedness, making sure that you have the right people on the ground leading the response to those crises, but also preparing for them as much as possible. Now, obviously, we know there's not There's not a single crisis that's similar to the other one. Everyone presents you with its own challenges. But being creative and being entrepreneurial and being willing to take certain risks in responding to a crisis and think outside of the box and have a can-do attitude that we take pride in at Project Hope, that we're always looking for a solution. No matter what the problem is, we'll always try to find a solution. But also preparedness. I mean, we can never prepare enough, right? We're talking about COVID-19, and we've been talking about pandemic preparedness for a long, long time. And when COVID-19 hit the world, nobody was prepared for it. But exercising and making sure that you have certain things in place that you could fall back on when things don't go right is very critical.
How large of a staff do you have to help respond to all these different crisis situations around the world?
We currently have about 1,000 and that are managing about 64 programs in over 25 countries.
And what's the largest crisis your organization has ever had to work on?
I mean, having been in existence for over 60 years, since 1958, as you can imagine, we've dealt with a lot of them. But I don't think any of them compares to the complexity of the COVID-19 crisis, right? We're dealing with the global pandemic that's affecting everybody all over the world. It's affecting our staff in the field, but it's also affecting the host community, the governments. There are restrictions there, and it's affecting us at home. I mean, having to pivot to working from home when most of our work entails travel and having to go to certain places and meeting with communities, meeting with the leaders, that impacted the way we do our work. And being able as well to respond to the needs in the world we live in and the countries that we serve, as well as the needs here at home, to really reimagining and re-engineering all of our work to be able to do that. Fortunately, we were able to do that with the resilience of our teams, as well as the people that we work for, and the use of technology as we're doing now. It helped us a lot to be able to tackle that as much as possible. But it is by far, I believe, the most complex crisis that we've had to deal with.
You mentioned earlier that every crisis is different for your organization. Do you have a generic crisis plan that is used to respond to any of these crises, or you have a different plan for every kind of crisis?
We have different plans. Usually, a natural disaster. There are certain ways you could approach a natural disaster. A humanitarian or complex emergency, what we call a complex emergency, there's a different plan to deal with it. Also, I mean, there are certain things that we deal with as an organization that has over 1,000 people working for, including sickness, including somebody passing away, or hijacking of your computers or network, or hijacking of staff. We have plans for those. But what we've discovered is that those plans are as good as you prepare for them and as good as the people that are taking the lead and executing on those plans, and being able to really take those plans, use them as a guideline, not as your bible. You don't let the plans dictate what you do. You control your plans and adapt to the situation on the ground. As we mentioned previously, Edward, there are no two situations that are the same. And one thing that makes Project Hope different is our ability to read and interpret the situation on the ground, interpret the needs, and find a solution that is specific to that situation.
So, what kind of training do you give your people on the ground so that they can do the best possible job to recognize and respond to a crisis?
That's a very good question. I mean, I wish we had the capability and the funding to do the training that we need to do. We do give them some training in terms of security training, for example. If you're deployed to an insecure environment, you need them to be ready. That you need them to know how to deal with the kidnap threat, or if they are shooting, if they're stuck in a shooting situation. But at the same time, we prepare them, we give them standard operating procedures in terms of how you deal with a certain crisis. If there's sudden influx of displacement, or if there's a coup d'etat in that country. Unfortunately, getting them to train on those, I mean, you need resources, you need the time, and you need to make sure that you do that very regularly. We don't do enough of that. No organization does enough of that. We're trying our best. But at the same time, we rely heavily on local solutions. I mean, bringing a solution from the US and say this is going to work in Malawi, it's not going to work. It has to be based on on a local solution and local givings, and what the culture and the staff on the ground would recommend, that that's a possible solution.
After every crisis, what kind of debriefing do you have with your staff? And what kind of lessons do you learn from one crisis that you apply to the next one?
Learning is critical. I mean, as an organization, Project Hope, we're all about teaching and learning. We teach health workers, and we learn from them just as much as we teach them. And it's the same thing in a crisis. Anytime you respond to a crisis, you see what worked, what didn't work, you learn from it, and you try to get better for the next one, to prepare for the next one. So we take a lot of what we call lessons learned from those crises in terms of what worked, what didn't work, and why that particular approach did not work, and see if we can actually adapt for the next one. So we use a lot of lessons learned from, after every emergency response, after we deploy the team to the field, they come back and we see, okay, what worked, what didn't work. Let's learn from it and let's improve on the next one. The same thing when we deal with a crisis, so no matter what it is. If it works perfectly, great. Then, we'll use the same approach. If it didn't work, try to understand what didn't work and why, the reasons why it didn't work, and try to adjust for the next one. I think any organization that doesn't learn from its response to a crisis or from its mistakes, I don't think they will continue to evolve. And we want to continue to evolve and do better. We deal with people's lives, right? Our job is to save lives and train healthcare workers. So we're not talking about repairing a car here. We're talking about people's lives. So it is critical that we do things as best as we can and that we learn from it for the next one.
Does any crisis stand out more than another in terms of it being so challenging and difficult that you really had a lot of problems dealing with that crisis? And if so, how did you respond to it?
Oh, I mean, there are many. As I mentioned, the COVID-19 is one crisis, but also if you look at the Venezuelan refugee crisis, and they moved from Venezuela to Colombia, throughout Latin America, all the way up to Central America, and trying to deal with that in different contexts, in different under different laws, with different feelings towards those refugees, is very complicated. So what we try to do as much as possible is understand the context, work within the local laws, and appreciating the local authorities, and at the same time make sure that we do not deviate from our principles, our humanitarian principles, making sure that we treat everybody equally, regardless of race, gender, religion, that we make sure that there's no preference for one group over the other, and that's always complicated in a humanitarian crisis. If you look at Yemen, for example, in between the civil war in Yemen, to the external factors that are impacting Yemen, to a malnutrition that's really rampant in Yemen among children, diseases that, whether it's cholera or other outbreak of disease, add to that COVID, that complexity in itself requires multiple crisis plan that you need to be able to deal with those.
What kind of turnover do you have in your staff? Is there, you see a lot of burnout? I know burnout can be a problem with any organization, especially when it's so intense dealing with different crisis situations. Is that a problem for your organization?
I mean, it is a problem for every organization, especially when you work in an industry like ours, in a business like ours, where, you know, it's always on the go. There's no downtime. I mean, we cannot dictate when a crisis would hit. And when a crisis hits, we'd better be ready to respond. But we've been doing a pretty good job actually keeping our staff. We focus a lot on staff well-being as well as their families' well-being, because I mean their families need to be happy and healthy as well in order for our staff to perform. And we keep them focused on the good things that happen. We deal with a lot of tragedies as an organization. When you're dealing with HIV, when you're dealing with tuberculosis or COVID-19, we deal with a lot of tragedies. And what we try to do is really help and empower our staff to look at the positive, at the impact that they've had in terms of saving lives, in terms of training health workers. So this is something that would reduce the burnout. We have staff that have been working with us for over 25 years now. And that shows you that, I mean, the mission of the organization in terms of saving lives and training health workers, it means a lot to people and it keeps them going. And it shows the commitment towards our mission and the satisfaction that they get from knowing that they're making a difference in this world.
If you had a wish list that you keep to help make things easier for you and your staff and your organization, what would be some of those items on that wish list? Or maybe you already have that wish list.
I mean, it keeps growing, right? Every day we keep adding to it. I mean, uh, for us, training health workers is critical because when a crisis happens, it's not us who respond to it. It's the local health workers on the ground, whether that's in the Gulf of Mexico or in Belize or in Yemen or in Nicaragua. It's your local health workers that respond. Our first wish is to really train as many health workers as possible that would go on and train others, what we call a multiplier effect. It's easy to treat a person and you can get that immediate satisfaction. But when you train a local health worker and then they go on and train others, you're treating hundreds and thousands of people. So that's the first wish for us, is to really try to close that gap in terms of health workers, because that would reduce the amount of crisis that we deal with, that I have to deal with as a CEO as well. The second thing is, I mean, we need uh, to take advantage of what's out there in terms of technology, in terms of partnerships with academia, in terms of partnerships with the for-profit world. We have a great partnership with the Brown University that helped us deliver over 80,000 training on COVID-19 to over 80,000 health workers. And by year end, we're hoping to reach 100,000 health workers in more than 130 countries. So that partnership, that thinking outside of the box as a nonprofit, working with academia, working with for-profit companies to really maximize your impact is what we aim for. And really being creative in terms of finding solutions. Again, the world is full of problems, and if we continue to focus on the problems and why things are not happening, we're not going to get anywhere. We want to focus on solutions. Similar to what you're doing in terms of lessons, in terms of leadership lessons. This is critical for me, for the next leader, for every person working either in the field or headquarters, whether it's a for-profit or non-profit, to be able to make a difference as well.
Well, based on your organization's wealth of experience dealing with crisis situations, what advice do you have for corporate America on how to prepare for and test their plans so when they do have a crisis, they'll be ready for it?
I mean, I learned a lesson earlier on, which is, as a leader, you always need to surround yourself by people who are smarter than you. And that's what I've done. When you have a team that is really performing and that love what they're doing, things become easier. So as a leader, the first thing that you need to do is really surround yourself by people that are smarter than you. Second of all, look at contingencies. And whether that's business continuity or crisis management, whether it's communications, whether for a scandal or if somebody passes away, or any potential threat to the organization, look at contingency planning, develop a plan, exercise those plans. Those plans will never be perfect, but the more you exercise, the more comfortable you become in addressing it. The last thing you want to do is, when you're facing a crisis, start creating those plans, because you don't have time for those. If you have something to fall back on, at least that would be the basic start. So make sure those plans are there. Make sure that there's ample communications about those plans. I mean, it's not enough for the CEO to know about those plans if everybody else doesn't. And make sure you exercise and you practice those plans and continue to learn. And also reach out to other organizations. There's a huge amount of learning that we can learn from others, whether it's from the military or for-profits or academia or nonprofits. Reach out to other organizations, see how they're dealing with certain situations, and try to learn from them.
They say one definition of a first responder is someone who runs toward danger and not away from it. And it sounds like you and your staff around the world has been running towards danger for decades. But a lot of company executives and corporate officers, they have no background, they have no training, they have no expectation that they will ever get into a crisis situations, and they're very surprised when they did. What advice do you have for someone who's running a company? They've never had a crisis, they don't think it'll ever happen, but today, next week, next month, they run into a crisis. How do they train for it, and how do they get ready for the unexpected?
That's a great question. I mean, anybody who thinks that they can survive a lifetime or a tenure as a head of an organization without a crisis, I mean, I don't know what kind of a company that they have. Every company will go through one crisis or the other. Hopefully, it's nothing major, but even staff crisis or even what we've seen in terms of lockdown. How do you pivot in a lockdown? How do you use technology? There's a lot out there. There are a lot of systems out there. There are a lot of crisis management plans out there. If you don't have any, reach out. I mean, you've got and I'm not just using this to advertise for your book, but you've got a great book actually that deals with that, and people should read it. It's great. Reach out to other organizations. There are companies that specialize in crisis management. Reach out to your staff. People actually on your staff have dealt with crisis before. They have what it takes to develop a plan. Reach out to your staff and see what you can get from them.
Well, my last question for you today is where can people go to find out more about your organization, and where can they contribute if they want to help you achieve your goals and objectives?
Well, thank you for asking that. I mean, Project Hope, for over 60 years, we've helped transform the health and well-being of people and communities around the world. We work on the front line of the world health challenges, partnering hand in hand with local communities, healthcare workers, and public health systems to ensure sustainable change. What we do is we really place power in the hands of local health workers to save lives around the world. And this is what I was talking about in terms of multiplier effect. If you want to help us, we'd appreciate it. There are a lot of organizations that do good work out there. I'm proud to say that we're one of them. We do great work. Go to projecthope.org, learn more about us, about what we do, where we do the work, and see if you can support us. That would be fantastic. At least spread the word about Project Hope and the great work that our teams in the field are doing, whether it's here in the US or globally.
My guest this week has been Rabih Torbay, President and CEO of Project Hope. Thanks for joining me today, Rabih.
Thanks so much for having me with you, Edward.
Thanks for joining me for this episode of the Crisis Ahead podcast. Remember, it's not a matter of if companies and organizations will have a crisis, but when.